Still live on the pulse. Thanks for staying with us. Now, scientists across the globe have welcomed the first evidence that a vaccine can prevent COVID-19. New York City-based drug company Pfizer, together with BioNTech in Mainz, Germany, co-developed the vaccine. The vaccine has been tested on 43,500 people in 6 countries, and no safety concerns have been raised so far. There are, however, questions about how effective the vaccine will be in the real world, how much hope it offers, to whom, and for how long. Let's cross over to Germany and take a look at how Germans and the EU are responding to the new vaccine. Thomas Sparrow is correspondent with our partners, DW. Thomas, exciting news first of all. What's the latest on this vaccine?
So the latest on the vaccine is that the European Commission has been negotiating a contract with Pfizer and BioNTech. BioNTech, the German company, you mentioned that already, to get around 300 million doses of that vaccine. This is important because the European Commission is actually negotiating contracts not only with these 2 drug makers but with other companies as well, to then distribute that accordingly within the European Union, and by the way, also when available in other countries. The big question now, the big question that is being debated not only here in Germany but in other countries, is first and foremost when that vaccine would be ready, because obviously those tests have been described as encouraging, but that does not mean that the vaccine will be ready anytime soon. And the second question is, what will happen once the vaccine is actually ready? How will that be distributed? Who will get access to that first? What will be the priorities? So as you can see, certainly an encouraging decision, an encouraging news story. That was something that was expressed by German officials, but at the same time, there are still important issues that have to be discussed and decided on, and that's what is happening exactly now in many European countries.
Now, Thomas, those 2 questions you mentioned are exactly the questions we put down to get answers to. Do we have an indication, for instance, when the vaccine will be available?
When you ask German officials about that, they say that they expect the vaccine to be ready in the first few months of 2021. If you ask, for example, in the United States, there are indications that that could be at the end of the year. It is still a big question when exactly that will happen. It is for now sure that the development is actually underway, and it is a promising development, but it's also relevant to stress that this is not the only vaccine that is being developed. There are many other companies, many other drug makers that are also trying to have their own vaccines, and as such, this has been described as a sort of race to see who gets the vaccine out first. Once the vaccine is ready, then the question is how it will be distributed. Here in Germany, there's a commission actually in place to try and discuss precisely these issues, because you can imagine this is not only a practical question, there are also ethical issues related to the distribution of the vaccine. There are legal issues related to the distribution of the vaccine. What has been decided on so far from a theoretical perspective is that priority will be given to those people that are in health risk groups. So, for example, older people or people with a health precondition. Second in line will be people in the health services. So, for example, doctors and nurses. So, in other words, people that have direct contact with COVID-19 patients. And third, people who are described as having relevant professions. So, for example, teachers or police officers. This is so far what has been discussed here in Germany. The vaccine will be distributed through centralized places, so regional centers, for example, and that has to do with the fact that, one, the vaccine, according to what we know so far, would have to be stored under very specific conditions, for example, cold storage, and second, to avoid that GPs, for example, at a local level would have to decide who gets the vaccine first and who doesn't get the vaccine. So this is why the debate is now focusing specifically on these centers at a national level. This is the debate so far in Europe. Each country obviously can determine what exactly they do with the vaccines that they receive, but here in Germany there is that structure which first and foremost has to do with those who are in risk groups.
Now, Thomas, a recent paper put out by the German Technical Corporation, GTZ, has shown that there is evidence that nearly 40,000 persons of Ghanaian migration live in Germany. How are these people and the rest of the country really responding to the lockdowns that have had to be reinstituted because of the second wave of the disease?
So there was certainly, as you mentioned, a partial lockdown that was reintroduced at the beginning of the month. It will last until the end of the month, although there are negotiations that will be decided on again next week between the German Chancellor and the regional leaders to see, A, how this lockdown is going, whether it is already seeing a specific effect, and B, what has to be done next, depending on that first question. What we're seeing now is that Germany is still recording daily coronavirus cases that are record. So basically various days where you see more and more cases being reported. At the same time, there are also initial indications that a curve may be slowly reducing, that the curve may be showing good signs. This is still, however, very unclear. The lockdown only started a week ago, and as such, German officials are very wary when it comes to deciding what will be the next step. Most Germans do understand the need for these restrictions. They do understand that the only way forward, if you're seeing record numbers, is precisely to stay at home as much as possible, to keep those hygiene and social distancing measures, and so on. But there is also a very evident coronavirus fatigue. That's also certainly the case, something that we clearly see also here in Germany, something that I myself also saw when I was out reporting. The big question for many Germans is what will happen soon. What will happen, for example, in December, when you have Christmas holidays, when you normally go and visit your friends and family, when you normally go out more to do certain things with, again, your relatives. So for now, Germans are obviously, most of them behaving, most of them remaining at home as much as possible, but there are certainly questions, and criticism is also growing as to what the German government is doing and what the German government needs to do to make sure that those numbers go down.
And I must admit, Thomas, that those questions of fatigue when it comes to COVID-19 and uncertainty about how Christmas is going to be celebrated are very, very evident here as well in Ghana. Many thanks for joining us, Thomas Sparrow. It was great talking to you, and stay safe, please.